Hello, everybody. Welcome to A Happier You Leads to a Healthier You. I'm your host, Goddess Asha Mariama. Thank you guys for joining me for this episode. I have Dr. Carl Rothschild. He is a actual person that came up with the red light theory and the red light bed. And I'm really looking forward to doing this conversation because the red light theory is something that's very new to me that I've never heard of. And with someone that has chronic pain and been going through issues with neurological issues, I found this very, very fascinating. And there are a lot of people that have been trying these beds for and this different type of red light theories for a number of years. And he's actually one of the founders of this actual particular type of thing that helps people when it comes to health and wellness. And also, he's also a chiropractor for multiple years. So I'm going to let him take it away and we can get started.
Well, thank you so much. I love talking about natural health and well-being. I started in the early 70s, if you can believe that, as a student at a pretty good New York college, university, and I was trying to decide what I wanted to do. I had hair down to here. Me and my girlfriend, we were pretty rebellious at the time. We had very good grades, but we weren't sure what we wanted to do with the rest of our lives. But one thing we got kind of introduced to chiropractic, and so we started calling chiropractors all over the country. And I never found a chiropractor that wasn't thrilled with being a chiropractor. And I said, you know what? That's what we want to do. That's what I want to do. I wanted to wake up in the morning. I wanted to help people more than I was focused on money. I was focused on helping people, number one. But number two, also, I wanted to wake up in the morning looking forward to going to work. And I got to tell you that not everybody feels that way. Not everybody feels thrilled about going to work. And I could tell you that I graduated and then started my practice in 1978, 79, around that time. And so we're talking about 47 years ago. And I loved it the whole time. I mean, there were challenges, but I really, really loved it. And then about 27 years ago, so I was 20 years into my practice, and I was handed a flashlight by a relatively famous orthopedic surgeon out of USC, who was also a professor there. And he was the first one to bring red light therapy really to the United States. And he hands me this thing that looks like a flashlight. And he said, use this on your patients. I had known him for years before he did that. And so I didn't think that, I thought he was crazy, by the way. Shine a light on somebody and it's going to make a difference. It didn't make sense to me because, again, being a wise guy from New York, I figured I knew everything. And turns out I didn't. And there I am trying this flashlight on a various variety of my patients. And it revolutionized my practice. I was able to do things that I never believed possible before. And it was spectacular. I mean, this lady had gum disease and she said, can you help me? And we had no idea. The only thing we knew back then was that it couldn't hurt. We weren't sure of how it worked or why it worked. But one thing we knew is we couldn't hurt somebody. So why not try it, right? And we did. And we helped her gum disease. And we helped this guy with his kidney problem. We helped this guy with a shoulder problem, an elbow problem, a knee problem. Uh, and then this one guy came in with a ripped Achilles tendon. It wasn't ruptured, but it was badly injured. And he needed surgery. We sent him to the orthopedic surgeon, and the orthopedic surgeon slated him for surgery on Saturday. This was Monday. So on Monday, through the whole week, I said, well, I have this light. I don't know how effective it'll be for you, but let's try it. And we did it every day that week. And when that guy went on Friday late to be evaluated for the surgical review, he didn't need surgery. And
Oh,
that's when we knew we had a really powerful thing here. And now we realize why the orthopedics don't love this, because they want to do the surgery. They want to make that $30,000. They don't want to not do the surgery. And yeah, they're not our best friends, but we do have a lot of friends in the healing industry. So
so
then
my
yeah, go
I
ahead.
have one question. So when the person came to you that basically essentially was having problems with their eyes, what exactly did they have to do in order for the treatment to start to work?
Did we bring up eyes yet? I haven't gotten there yet. Are you
Could
skipping
you,
ahead? Is that what you're doing?
No, because you remember you told me the story about the guy that
Okay, but
almost lost his sight.
let me go through this, to make sure everybody's up to speed with us, and then we'll get to eyes in just a moment.
Okay, I just want to make sure. Okay, just want to make sure.
So there I am, about 20 years in to my practice. I'm sorry, so there I am 27 years ago using red light therapy. And about 13, 14 years ago, I was introduced to the fact that there was an element of light that I wasn't using that would help shrink fat cells. It helped people lose weight. And I don't know if you realize, maybe you do, if you watch television enough, you'll see so many commercials about injecting people, then inject themselves in their butt and whatever to lose weight. And, again, chiropractors are not a big fan of putting crap into our body. We don't put drugs. We don't inject ourselves. We don't take drugs unless it's an absolute last resort. So I'm not a big fan of doing something that's not natural. So imagine if we can use a certain type of element of light to actually shrink fat cells that's completely healthy, non-invasive. You don't even realize there's nothing much you're feeling that's going on, but sometimes in 2 weeks, we'll see some people losing several inches off their body. And I'm going to go over the mechanism in just a minute, but what that meant to me was I wanted to get even more involved. Now, up to that point, I was pretty involved, but now I wanted to get even more involved. I started manufacturing about, let's say, 13 years ago, and creating devices that would assist us with healing and fat loss at the same time. And we were involved with lasers and pads and whatever. But again, I am manufacturing, and then COVID hits. And our practitioners, and we had hundreds of them at that time, they wanted less physical contact between the patient and the provider as much as possible. And so what we did is we created this bed. I don't know if you can see it on the screen. This is
Yeah,
actually like many generations later from our first bed, where we created a bed, something like this, where the person would get in the bed themselves and they can get out of the bed themselves. So from a COVID point of view, you don't need physical contact between the patient and the provider, and our providers loved it. And we just thought it would be a nice replacement for what we were producing up until that point. What we didn't realize is that when you bathe the whole body from head to toe, left and right, front and back, and inside and out, all at the same time, you're starting to get results that are different, miraculous, incredible. I don't know what else words to say, and I know I sound a little crazy here, but I am. I mean, I am so in love with this stuff and so passionate about this stuff. And then remember, I was a hippie. I wanted to help people, and now more than ever, we're getting people to tell us thank you for giving me my life back. So it's very rewarding. And so again, we're going to go over the mechanism in just a moment, but these people are now calling us up and telling us about results that we did not anticipate. For example, we had this one guy that was diagnosed with congestive heart failure probably 15, 16 years ago. About 12, 13 years ago, they implanted a defibrillator in his chest because his congestive heart failure was so severe that he was having heart attacks regularly. In the beginning,
wow.
once a month, then twice a month. Eventually, by the time we met him 12, 13 years down the road, he was having as often as twice a week. And every
Wow.
time he died, the defibrillator would zap him back to life. But he was suffering tremendously. He had been an athlete earlier on, and now he couldn't get around the block.
Oh, wow.
So the practitioner calls me up and says, should I even treat this guy? I don't want him having a heart attack in my office. And I said, you know what, let's just treat him for 5 minutes, just 5 minutes, and stay in the room the whole time. Now, normally a dose is 12 minutes. So he's going to get it for 5 minutes, and that patient goes home. That was almost 2 years ago. Hasn't had a heart attack since. He's had more treatment, but no more heart attacks.
Wow.
And everything has come back to life.
Wow.
His energy, as he puts it, is through the roof now. His mood, of course, because he's not depressed anymore, is through the roof as well. His erectile dysfunction is gone, and every organ, every gland, every tissue in his body is now normal. His blood pressure is normal, his pulse is normal, everything is normal. And believe me, nobody had an answer for this prior to the bed. Nothing. There was nobody that would have been able, they didn't have an answer for this other than to zap him back to life every time he died. But it was getting more and more frequent, and eventually there'd be a final one and he'd be dead. And now
Wow.
that's not going to happen.
So he just laid in the bed for 5 minutes and it just did all of that for how many days?
Well, it was 5 minutes the first time, and then after that, he went to 12 minutes, per session.
Okay.
Um, he lived very far from the closest office that we had from him for him, so he could only make it once a week. But normally, a dose is 3 times a week, and the schedule is normally 3 times a week for chronic type problems. We've seen people 1 or 2 times a day if it's really an acute thing, like just cut themselves their burn. We had a lady that had third-degree burns. It was
Oh, wow.
horrible looking. And she was guaranteed by the wound center to have permanent scarring, but also 6 months of pain and 6 months of drugs. And by the second week, the end of the second week, the pain was gone. And by the end of the third week, it was gone. There was no scarring, there was no nothing. And so the skin is remarkable. We had this one lady that had 3 forms of psoriasis amongst many other problems. And within a relatively short, I mean, she had rashing across here all the time. Her ears were always red and bleeding. She had rashes down her arms, down her legs, all the time.
Oh,
Within
wow.
2 weeks, that was all gone, all gone.
Oh, wow.
So yeah, it's not difficult to fall in love with something like this, because I'll tell you, from a building a practice point of view, we know that satisfied patients are not the ones that refer. It's excited patients. And so if you have somebody that couldn't walk and now they're walking, we have somebody that was going blind and now won't go completely blind. There's some tremendous excitement. When we have somebody that's diabetic, we have somebody that has renal failure, their kidney is going, and almost gone. And they were
Uh,
guaranteed to be on a dialysis relatively soon after that. She started using a red light, and her kidney is perfect, no problem at all.
so would it help with something? And I'll give you an example. My mom is having issues with her knee and her toes, and she had knee surgery, and she was in a whole lot of pain. And at first, it was just in her knee, and then it went from her knee to her toes, and now she's having this numbness in her toes, and she doesn't know why she's having that. Would that be
Oh,
something that would be good as well for her?
okay. So the bed is always a good thing to try.
Okay.
Um, if somebody has an arrow in their shoulder and we put them in the bed, don't be surprised if it's not completely cured, because we got to get the arrow out. So if she has a structural imbalance, if maybe when they did the surgery, they did an issue, but more likely she also has a spinal problem. Or,
Okay.
or who knows, maybe it's a swelling from the surgery that's causing problems all the ways down the leg. But most likely it's a neurological issue that usually emanates from the back. So until we find the cause of the problem and the root of the issue, and get to it, then I don't know. But the bed is a good first start.
Okay.
But we want to make sure that people know how to sit, how to stand, how to sleep, that they're using the right beds, pillows, chairs, car seats, shoes, whatever, that they're doing everything right for themselves. So that's a separate story. As a chiropractor, I wanted to make sure that my patients were not undoing the work that I was doing with them. Here I am making nice and adjusting and doing all these things, and then they go home and screw it up. That doesn't last. It doesn't work. It's the same thing with the diet. If somebody is using red light to lose fat, which it works very well for, but they're going home and undoing that by how they eat. One of the worst things is alcohol. Alcohol destroys the success that you would have with fat loss. The way alcohol is consumed and metabolized by the body is like sugar, and sugar is a killer. In fact, the 4 things that we ask people for dieting weight loss to kind of limit, if not eliminate, is starchy carbohydrates, simple sugars, sodas, and alcohol. Now, there's many other things that person can help them with, but limiting those 4 things and using red light therapy and staying on what we call a calorically neutral diet, not eating more calories than you need in a day. Because obviously, if you eat more calories, it's going to be stored as fat. That's just the way the body works. So
Okay.
we're not asking anyone to go on a starvation diet. We're asking them to go calorically neutral and be smart about what they eat, and then incorporate red light therapy, and it works. It really works nicely. But at any rate,
So with the chloride, okay, please, okay, I wanted to get a little bit more information about what that is as far as that caloric nutrient diet. What does that consist of as far as helping people when it comes to weight loss? Because there are a lot of people that they'll lose the weight and they'll walk, they'll do everything they're supposed to, but then they don't maintain it because the whole purpose of them losing weight is not for health reasons, is for other reasons. So I'm just trying to figure out how does that diet work as far as that goes.
I hesitate to use the word diet because the problem with the word diet is that it means there's a beginning and an end. When you end the diet, you can put all your weight back on. So that's a mistake. What you want to do is to make lifetime changes. You want to make changes to your life that you can easily, somewhat easily integrate into your life so that you're not suffering. We're not having someone to starve because we know that's not going to last. I was introduced to diet and weight loss when I was a preteen, when my mother became an executive of Weight Watchers. And I never had a good thing to eat again, while I was living at home. So bean sprouts instead of spaghetti was the common theme. But I will tell you, it's not difficult from a structural point of view. It's difficult from an emotional point of view. A lot of people, like people who are trim and don't have an issue with eating, they go, why don't they just stop eating? What's the big deal? Because they don't understand that it's much more than they'll say, I only eat when I'm hungry. And that's not true of an eater. I was surrounded by what we call fatheads. A fathead is somebody that's motivated by food. Maybe I'll call it a food head, whatever you want to call it. Whereas opposed to, like, I don't drink alcohol. I have no interest in drinking alcohol. It's no struggle for me, but I'm not bragging about it. It's not difficult. So someone who has a struggle with it, they have something to go through. I was raised in the idea that we all were put on this planet to go through our junk. We have to go through that crap so that we get to a higher quality of a higher level consciousness. And so we all have our weaknesses and we have to go through them. If you have a fat weakness, then you just need to learn what you're like and live with it, but understand that if you eat more in a day than you need, that's a problem. So let me just tell you what a meal should be like, and it's not a difficult thing. And so if you stay away from any grain, you'll do better, except for rice,
Okay.
maybe. So it's protein and fruits and vegetables. That's it. Protein, fruits, and vegetables. That's it. And that's all you eat, you're okay. Now, of course, you don't want to eat 4 pounds of protein, but you have a smart amount, usually about 6 ounces of protein and about this much fruits and vegetables, 2 fistfuls. And that's the
Okay.
meal. Now, I only eat 2 meals a day. So I eat at noon. I have protein and fruits and vegetables. I really don't have fruits at my lunchtime. So I'll have protein and I'll have vegetables. Then at somewhere in between that and 6 o'clock, maybe 3 o'clock, I'll have a little snack, which is about 100 calories of a protein bar or something like that, but no junk in it. And then for dinner, and I wasn't going to go over this stuff. I mean, I can go on for 2 hours just on weight loss, but
Glad you're
uh,
going into it because it's a health channel. So I mean,
I think
we
we'll do
gotta go
that
through it
another
all.
time because I got so
Yeah.
much to go over with the red light therapy. But anyhow, getting back to the dinner is the same as lunch, no different. Protein, vegetable. My fruit comes in pretty much as a dessert, and that's my dessert, my fruit. So fruits and vegetables and protein. I'm not saying it's the easiest thing. Listen, I was raised that the kitchen was the center of every party because everybody was eating. And my mother had 3 boys, and my father was the fourth boy, and she would put the food down and it was like, rah, 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 it couldn't get it in their mouth fast enough. And but I learned and I trained my patients because if a patient loses the weight, their spine is going to be grateful, right? Anyhow, so I don't want to belabor the point because to drive home what really red light therapy is about is even in this case just now more important to me. And the reason is because so many people have misunderstandings about it, and they really need to understand the truth behind the red light therapy. So we talked about the fact that we introduced the notion 13 years ago that red light could help with fat loss. I also talked about how we moseyed on over to a bed several years ago when COVID first hit, and how it made such miraculous changes. What I'd like to do is to go over why it works. What's the
Yeah,
process? I think people should know this.
absolutely.
There are two complete separate mechanisms. On this hand is weight loss, and on this hand is everything else. On this hand, with weight loss, that's just about red light. Now, there are other lights that I'm going to talk about, but this is just red light, only red light, no other color, no other element. Red light has been shown to help with fat loss. And the way that it works is that this red light at the certain, if it's a high-end medical grade device that filters into that very perfect wavelength, then it's driven into the fat cells. What they found is that the fat cell wall temporarily becomes more porous. That means it allows the contents, some of the contents, to leak out into the surrounding tissue. And then with our unique protocol, we move the fat away from the fat cells and eventually to the liver for use or elimination. And it works.
Okay.
And that's why we also will take care of that. We'll be nice to the liver because we need a healthy liver. And if your liver is not great, it will be a little bit more difficult, but we use liver supplements to help the body protect itself and get that liver to working as well as we possibly can. And that's how simple fat loss and weight loss is. So let's talk about the glorious wavelengths. This is more important to me. Although fat loss will bring more patients into a facility than anything else. However, I'm a natural healer. I love healing. And the healing aspect of light therapy is quite remarkable. And it's mostly near infrared. So when people want to understand the wording infrared, there are two kinds of infrared. Far infrared, which is just a fancy way of deep penetrating heat, and near infrared, which is what we used to call cold therapy. It doesn't literally get cold, but it doesn't get hot. And so you want it not to get hot. Heat is the enemy. If something gets hot when we're doing our lights, then if somebody, for example, if the lights were getting too hot, because that's what the cheap junk that's coming in from China, they get really hot because they're low grade. Ours are high-end medical grade devices that don't get hot. Heat is the enemy, and you want to avoid heat as much as you can. Dilates blood vessels, creates more fluid in the surface, and that blocks the penetration of the light. The last thing you want is heat. So now with the healing element of near infrared, which is cold laser or cold therapy, what we're going to do is drive this beautiful wavelengths of near infrared and a little bit of red into the body. And they found that it can be very healing, but they didn't always know why and how it worked until more recently. But before I even go there, I also want to point out there are no side effects at all. In the 50 years of this technology been studied, there's never been a recorded side effect. And there's really no contraindications. The only contraindication is pregnant women. And the reason is because the lights would be helpful to the mother and fetus, but if that baby comes out anything other than perfect, they're going to want to blame somebody. And I tell everybody, let's just stay away from that. Let's not be in that neighborhood just while she's pregnant. And then after she delivers, you're going to want to treat the heck out of her to help her, especially after C-section. It'll be remarkable the speed with which she'll heal and recover, and pain will be gone much quicker.
That makes sense.
But so there really isn't any much contraindication other than that. So you can get in the bed with a defibrillator, pacemaker, electrical components. You can get in the bed with shoulder, hip, knee replacement, metal, titanium, all that stuff, not contraindicated. So let's get back now to what I wanted to also talk to you before I tell you the mechanism of how near infrared and healing works. I want to point out a few things. That's kind of what the bed looks like. This is the newest model, as a matter of fact. I wrote the book, Illuminated Healing, and I would recommend you get that. I do not make a penny off of that. All the profits go to charity, and it's called Illuminated Healing, and you can get it on Amazon.
Okay.
Third thing is the website, trifectalight.com. I recommend strongly that you go to trifectalight.com. And go to the contact us, go through the whole website if you'd like, but go to the contact us page. And on the left side, if you want to find a facility near you, because I'm telling you, each of you should try this bed 6 times. 6. Each dose is only 12 minutes. Get in the bed for 12 minutes, 6 times. That's 3 times a week for 2 weeks. And at the end of the 6 weeks, you should see a change. Now, if you're feeling great, maybe you won't see a change. But the messier you are, the more problematic your issues are, Usually by the end of the 6 visits, the more remarkable the change will be. Now, you're most likely going to need more treatment than that, or at least that's a possibility. But at least within those 6 visits, you'll find out. So you go to the website, go to the left side of the contact us page and click on that and give us your location. And we just need your city and state. And one of our staff members will send you the closest office to you. We can't list all the locations for privacy reasons, but we can find the location closest to you. Now, on the right side of the contact us page are the 2 reasons why some people might want to buy this bed. If people have more money than health, they want this bed. I'm 72 years old. I get in the bed 3 times a week without any ailment because I don't want to have any ailment. I liken well-being and health to be like a candle that burns bright all the way from the beginning to the end and then sputters out and dies. Not that the last 20 years of a person's life, they're living as an invalid where they barely can get around. They can't wash themselves. They can't feed themselves, and they can't even wipe themselves. I don't want that. And I don't want that for you guys either. And if you want to avoid that, do everything you can. The reason why people don't take care of themselves sometimes, if not often, is because they're not scared enough. You do not realize what your life's going to be when you're 75, when you're 30. And when you're 30, when you can make a difference, that's the time in all those years. Take care of yourself so that when you're 75, you have a vibrant, healthy life. Not that you're, barely functioning. Okay.
Yeah, 'cause that happens a lot. That happens a lot. A lot of people don't really do anything about their health until they get scared or something really bad happens. And it's just like people that are cancer patients. They'll go and they'll get the chemo and they'll be cancer free and then it'll come back. And it's just crazy how it takes something traumatic for people to appreciate their health and wellness and appreciating that. So, because is that the reason? Because I was going to ask you, a lot of physical therapists, when they do our physical therapy, they put the thing on our bodies and it's like a massaging thing, a little circle thing. And they always start with cold and they always say cold is better. So that's why I said, when you said that, that's what came to me was when they put that on there, they always try to do cold because the cold works a lot better when it comes to, electrifying your nervous system and setting it on fire, I should say.
That's not quite what we're dealing with here. So
Now,
cold.
I was asking about that because when I was thinking about when you were saying that, I was thinking about that thing that goes on, they put on your back and it goes around with the cold versus the heat. When you said that, I was just thinking about it from that
But
philosophy.
it's a totally different animal. So the only thing I'm talking about is the reason why you don't want heat is because that will bring blood to the surface and that will block the penetration of our lights.
Okay.
Now, as far as using heat or ice, depends on the severity of the problem, how acute the problem is. If you have a chronic issue that's been around for a long time, most people will be using heat for that. But if you have a new
Okay.
issue that's really acute and swollen, that either you use nothing or use ice. You don't want to put heat on a swollen area because it'll make it even more swollen, right? So
Yeah, that's why I wanted to get clarification because when you said that about the heat and light, I was just trying to make sure because let's say, for example, a person has chronic pain versus swelling, the red light takes the cold. So that's why I was just trying to make sure. So that way,
it's not
people
related
that,
to the same notion of ice therapy versus heat therapy. That's not what this is about.
yeah,
It's
that's why I
about
want to clarify.
avoiding heat so that the lights can penetrate the skin. At any rate,
Okay.
so moving right along. So let's just talk about. So we talked about the bed. We talked about the book. We talked about Did we talk about the YouTube channel? Maybe not. Go
Not
to
yet. No.
go to YouTube. Put in the word Trifecta Light Official. One word. Trifecta Light Official, and you'll find over 120 videos, and they're good. They're really good, well done videos of testimonials and all kinds of really well put together. Some of them are interviews of me and other famous health practitioners. So I would recommend you go there. Now, let's just finish up with the mechanism of how the near infrared helps with healing. And so what it's all about is your body is made up of tissue, and each tissue is made up of cells. And every cell has an element called mitochondria in each cell. So this is why it's so global. We're affecting the mitochondria with our near infrared lights and a little bit with the red as well. we're affecting the mitochondria in every cell of your body. So that's why it can help so many different conditions, whether it's neurological, brain, whether it's skin, whether it's bone, whether it's glands, whether it's organs. All of them are made up of cells. All of them have mitochondria. So let's talk about what is the mitochondria. The mitochondria is the powerhouse of the body. It's the reason why you breathe oxygen and eat food. You breathe oxygen and eat food to create this miraculous molecule called ATP. And that is the energy currency of the body. That's what's required for your body to function, period, and heal. So every function in your body requires this ATP, and it's the mitochondria that produces it. So what stimulates the mitochondria to come back to life? What they're saying is as someone gets diseased or as someone gets older, their mitochondria starts not functioning correctly. They call it mitochondrial dysfunction. Now, how can we bring the mitochondria back to health? What they found is that it's basically about sunlight. It makes sense that the sun has such an effect on the world that you and I must have sunlight on a regular basis to be able to survive. If someone lived in a cave, I guarantee you they would not be as healthy as people who are not living inside of a cave. So get outside. But on top of that, using our red light therapy, we're going to stimulate the mitochondria even better than the sun does. Now, I love,
Okay.
I'm not going to say we're better than God or better than whatever you want to call it out there, but I'm going to tell you that what we've done is we've taken sunlight, magnified it many times, and drive it deep into the person's body. And what
Okay.
that does from the healing point of view is that they found that there is a molecule, there's an enzyme in every mitochondria called cytochrome C oxidase, and a series of enzymes in each of these cells and each of the mitochondria. So we're stimulating, and they're chromophores. What's a chromophore? It can be stimulated by sunlight. Not every tissue in your body is stimulated by sunlight. Some of them are, and cytochrome C oxidase is one of those. Stimulated by sunlight. When it gets stimulated, it brings the mitochondria back to life, and now it starts to produce the right amount of ATP for your body so you can fight off any diseases, so that you can heal from many of the issues that you have. And it's why the kind of results that we're seeing are so global.
Okay.
Like you before, you were asking me about the eyes, right? And I kind of said, let's
Yeah.
hold off. So we can talk about the eyes now. When someone gets in our bed, they keep their eyes closed and their mouth open. The mouth open so we can get past the bones of the teeth and get into the mouth. But the eyes can be closed because the eyelid is so thin, our lights will easily penetrate the eyelid. And I'm telling you, the light can get through your brain, get to your brain through the skull, and then it's very easy to get through the eyelid. Can you
Okay.
can you open your eyes? Of course, but it's like a very bright light that it's annoying if you just keep staring at it. So we just tell people just keep your eyes closed, and what you're going to find is all these glorious results inside of the eye. Now, were you asking me specifically about somebody that had an eye issue?
You said there was someone when we were talking about a man that had an issue with his vision and it was literally almost gone, and they were able to save it based upon the red light to
So
be
he
able to.
had he had Leber's hereditary optic neuropathy. That's LHON. And there's a whole community. It's not common, but there's a whole community of people that have that problem. And what it is essentially is it's like multiple sclerosis of the retina, which
Oh
means
wow.
it's kind of eating away at the retinal tissue, which is nervous tissue. And he was half blind by the time we met him. And what we were able to do is prevent the progression. We halted the progression of that disease. We were not able to reverse what's already damage has already been done, but it looks like we're going to be able to stop it from continuing any further. And he's thrilled. I mean, he was
Okay.
going blind. He was guaranteed to be blind in a couple of more years, and now he won't. On
Oh
top of
wow.
that, he was having a variety of different headaches, including migraine headaches, and they're all gone. And he can sleep well now and all that stuff. So he was thrilled with like that. And I have dozens of stories about people who've had such amazing results. One of them is example um, is Lyme disease. I don't know if you've heard of Lyme disease or you know people
Yeah.
with Lyme disease. We
I
have one
do.
guy, I mean, we've seen this a lot, but we have this one guy, his name is Steve. This one we haven't seen before because he contracted it when he was 12, and it ruined his childhood, it ruined his social life, it ruined his education. Of course, it ruined his capability of even having a career. There were times when he would get out of the car and to make it to his apartment was a struggle. His energy was gone and he was highly depressed because his life was ruined. And so someone convinced him in his 50s. So he's 40 years out from having first contracted it. And now he gets in our bed and gets out of the bed after the 12-minute treatment and doesn't notice any difference. And he just says it's just a bunch of hooey and moves on. But 5 hours later, and ever since, it completely changed his life. So what I'm
Oh,
going
wow.
to tell you is I'm going to be sending you some videos that I'd like you to send to your audience and
Oh,
watch the
please.
one on Steve. You'll watch the one on Arnett, who's having the heart attacks. Watch the one on Jessica, who also had Lyme disease, but a million other problems. She literally had 16 serious conditions. And one of those was uveitis. I don't know if I mentioned that to you before. So,
No, you have.
so uveitis, the treatment for that was the copay for the drops that she needed to use. Just the copay for the drops was $400 a month. And she also once a month got injections right into her eye, which I
Ooh.
asked her about that. And you got to watch that video. Her name is Jessica. And she talks about the uveitis, and it's horrific, injecting right in the eye. And they charge the insurance $5,000 for each injection. And
Oh,
after
wow.
a couple of weeks of red light therapy, that was all gone. In fact, all her conditions were resolved, including 20 years of diarrhea, including shingles, Lyme disease, as we talked about, the uveitis, the 3 forms of psoriasis. I mean, just so many different things. And so you never know, right? If it's going to help you. But I'm going to tell you is you go to the website, go to the contact us page, click on the left side. We'll find a location nearest to you. Try it for 6 visits. And I feel confident that if you have a problem, it will help you. Now, if you don't have an issue, I don't know if you're going to see a difference. But if you have an issue and the worse off you are, sometimes the more dramatic the change will be. Try it for 6 visits. Each dose is only 12 visits. I'm sorry, 12 minutes. So anyhow, as you can tell, I'm a little nutso about this stuff. I love it. I love the fact that I'm helping more people than ever before, and how often I hear, "Thank you for giving me my life back." It's very
Yeah.
rewarding.
There's a lot of people that would have loved you because I have a friend of mine, he does documentaries, and right now he's doing something on menopause. And they went to Mexico and they treated cancer through holistic treatment and things like that. But yeah, they would love you because I mean, it's so many people that are going to doctors and they can't find out what's wrong with them and they're not getting answers. And it's just frustrating because they don't know how to treat what they have until it's too late.
Well, whoever you know is very welcome to at least go to the website. We'll find a location close to them and try it out for 6 visits. I will tell you that women's health is one of our 8 divisions of the company. And so in the world of women's health, we hear of much less painful periods within that first month. We'll hear of even cysts on the ovary and variety of other things resolved and doing much better with that. So with that said, I wish you all the best. If people have questions, they can go to the website, go to the contact us page, and towards the bottom of that, they can just ask questions and make sure, say, please get this to Dr. Rothschild, and I will respond. That's what I do all day long. I'm helping answering questions, helping with training, coaching, and all kinds of stuff to help people be as successful and as healthy as they possibly can.
Well, you definitely have helped me because you have given me some very insightful information that definitely has helped me. Even when we had our conversation prior to this, I learned a lot and I've been incorporating a lot of those things. So thank you so much for even taking the time to even come on my podcast. I greatly appreciate you. And
My
this information will help a lot of people because there are a lot of people that have weight loss issues and like you said, it's always incorporated through food. People find out it's fibroids, thyroids, hernias, hysterectomies. It could be anything. Weight isn't always just because of what you eat, but it's also your lifestyle and all of those things that are important. So I thank you so much, Mr. Rothschild, for coming on my podcast. I appreciate you. And I hope you guys enjoy this podcast and enjoy this episode. There will be more to come. With that being said, I am your host, Goddess Asha Mariama. I appreciate y'all for joining me. And until next time, we'll talk later. Bye, y'all.
Bye bye.